Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication from the benzodiazapine class, known as Alprazolam, or more commonly known as Xanax. As always, keep in mind that this channel is for information purposes only and not to be used as a source of recommendations for your personal health care. So Alprazolam, or Xanax, is available in many different forms in terms of dosage forms. The most common would be the oral tablets, which are available in 0.25 milligrams, 0.5, 1 and 2 milligrams. There's an oral liquid that's available as a 1 milligram per mil. There are tri-scored tablets as well as extended release tablets. And finally, oral disintegrating tablets. Alprazolam is considered a short-acting benzodiazepine, and there's three common places where we see it prescribed. One is for anxiety disorder. Another is panic disorder, and we also see it used in surgery occasionally, such as dental surgery for a sedative effect. In short, benzodiazepines work by binding to the GABA-A chloride receptor complex. This causes an increase in frequency of the opening of the chloride channels, which facilitates in the inhibition of firing of neurons at the level of the limbic system. Before an individual was to use this medication, there are some precautions that they should be made aware of. This medication should not be used in people who have sleep apnea. It should be given with caution to the elderly population, especially those who are at risk of falls. Anxiolytics in general lower the tolerance to alcohol, so if you were to use this medication with alcohol, there would be an additive effect. With prolonged use, there can be physical as well as psychological dependence that can develop. Some individuals who use opiates may turn to benzodiazepines to alleviate their withdrawal symptoms. This can lead to an increase in death by methadone toxicity by obstructing upper airways. Withdrawal symptoms, which may occur after one stops using the medication, are similar to alcohol withdrawal. If one was using at a high enough dose and was to stop abruptly, this could result in grand mal seizures. Now, when somebody is starting this medication, the dosing depends on the reason that they're using it. In anxiety, an effective dose could be 0.5 to 4 milligrams divided throughout the day. The manufacturer recommends starting off at a dose of 0.25 milligrams to 0.5 milligrams 3 times daily. This dose will be titrated upwards until the patient realizes the desired benefit. We typically try to keep the dose of alprazolam at or below 4 milligrams daily, but occasionally some prescribers will go above that and increase the monitoring. In panic disorder, it's recommended to start off at a dose of 0.5 milligrams taken 3 times a day and increasing the dose every 3 to 4 days. You typically don't want to increase the dose by more than 1 milligram per day. For this purpose, again, panic disorder, we will see doses higher than 4 milligrams a day. Some have even been reported as high as 10 milligrams a day. The dosing in both scenarios would be different if you were using an extended release tablet or one of the other options. If somebody is using the extended release tablet, they should try to take it as best as they can at the same time each day. It's also to be noted that with this form, a high-fat meal can delay the absorption of the medication. For the regular form of alprazolam, the onset of action time is 15 to 30 minutes. As with all medications, if you're using this medication, there are some side effects that you may experience. The most common side effect seen with alprazolam and other benzodiazepines is a generalized sedative effect. The alprazolam XR version may have an extended daytime sedative effect as well. Some people experience impaired memory or impaired mental speed. Some people have a decrease in central cognitive processing ability, and others have impaired perceptomotor performance. These are typically dose-related. Unfortunately, a tolerance to the short-term memory impairment does not develop over time with this medication. Some people, when using this medication consistently, may find themselves become more irritable, while others may find themselves more impulsive. Excessive doses may result in respiratory depression or apnea, and muscle weakness and headaches may also occur. Some patients, generally the elderly population, may experience some anticholinergic side effects such as dry mouth or blurred vision, and others may experience sexual dysfunction. That's all I have to say about alprazolam or Xanax. There wasn't too much to cover with this medication. If you're interested in learning about other benzodiazepines, I have covered clonazepam and lorazepam in the past, so you can check out those videos on the channel. As always, I appreciate you taking the time to watch my videos. If you'd like to help support the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. Thanks, take care.